Welcome to rePROs Fight Back, a podcast on all things repro. I'm your host, Jenny Wetter, and each episode I will be taking you to the front lines of the escalating fight over our sexual and reproductive health and rights at home and abroad. Each episode, I will be speaking with leaders who are fighting to protect our reproductive health and rights, to ensure that no one's reproductive health depends on where they live. It's time for rePROs to fight back. Welcome to rePROs Fight Back. I'm your host, Jenny Wetter, and today's episode should be a fun one. Being in Washington, D.C., I get to take advantage of working with a lot of amazing organizations that bring in advocates from around the world to talk about sexual reproductive health and rights. So today I get to take advantage of Marie Stopes International, bringing in a wonderful advocate from Zambia. So today I'm going to talk to Inonge Wina-Chinyama with Marie Stopes International Zambia about Zambian teenagers and sexual health. Hi, Inonge.
Hi.
Thank you for being here.
Thank you for having me.
Are you enjoying your time in D.C.?
I am. I just came through this morning, like early in the morning.
Oh, my goodness.
Yeah.
Have you at least been in the States a little bit to get on the time, or are you still?
I think I'm still a little bit confused. I've been in sort of different time zones. I was in London, then I went to Aspen, I went to Denver, and then I'm here.
Good, good. Okay. So what is life like for teenage girls in Zambia?
Being a teenager in Zambia can be exciting. It's fun. You think you're in control of the world. You're in control of your own life. Sometimes when you're not, when you're a teenager, you're really outgoing. You have lots of friends whom you share secrets with. You talk about boys. You talk about relationships. You talk about sex. But you don't really have someone older whom you can talk to, whom you can trust. You always feel like, I can't talk to that person. What if they go and tell mommy or daddy? What if they think differently of me that I'm talking about sex? So being young, they keep to themselves and talk about these issues without a lot of facts. Being young, you feel you can't go to a health facility to get any sort of support concerning your sexual health decisions because you're too scared to do that. Teenage girls are very scared of pregnancy. Most of them more scared of it than HIV because when you get pregnant, very soon everybody will know that you're pregnant because the pregnancy will start showing. They're not scared so much of HIV because they think, I can get treatment. So for Marie Stopes, it was a case for integration to say, how do you integrate HIV and contraception or prevention of pregnancy? So being young can really be confusing, especially if you don't have someone to reach out to get facts about your sexual health.
Is it easy for them to go out and access services like contraceptive services?
It's not really easy, because sometimes just the culture itself does not allow you as a young person to go out there and start seeking for such services because you are not expected to be having sex. How can you go out there and start looking for contraception? You are not supposed to be having sex. Sex is for us who are older, who are married. It's not for you. So you can't go out and start talking about it. You are too scared. And sometimes you can't because when you go to a facility, maybe the provider there is very biased. The provider there might be mommy's friend who say, I know your mommy, what are you doing here? So there's really lots of barriers. Even if girls sometimes would want to come out and say, look, I really want to have sex. I'm not sick. I just want to have sex safely. But where do I go to and feel that this service is discreet and it is private and I will not be judged? So it's not the easiest to actually go out there and access services.
So is the bias around being unmarried or being young, or is it both?
It's actually both. But I think the hardest is being young and unmarried and without a child.
Right.
So sometimes it's easy when you've had a child before. Everybody's like, she already knows sex. She's had a child before. It's okay for her to go and look for contraception. But when you're not married and you do not have a kid, it's not expected of you to actually go out there and look for contraception. I'll give an example on one of the times when I was out in rural Zambia doing my field work. we had this young girl who came to me and said, "Oh, can I talk to you for a bit?" I'm like, "Oh, yeah, sure." And she was like, "Oh, I had sex once and I got pregnant, but I also got HIV." And she had a little baby with her. And she was like, "And this is my baby, who was maybe around 6-7 months old. And he's also HIV positive." That was really sad. And her question was, "Is there hope for me?" And I looked at her and I felt really sad because we had failed her. There were lots of moments in her journey where we could have helped her. The time she was thinking of having sex, there was no one to talk to her about safe sex. The time she had unprotected sex, there was no one to talk to her to say, "You can actually go and get help in case you've contracted HIV." The time she discovered that she was pregnant, there was no one to talk to her to say, "You can actually protect your unborn baby from getting HIV." So those are the barriers of a young person. And she couldn't come out and ask anyone because she was too scared. She had already made this big mistake where everybody was saying, "You are a naughty kid, you've been having sex, look at you now, you're pregnant." So where could she go to get help? All she needed was someone to facilitate that journey. And all I did was to take her to the clinic where we were, to say, "Here, let me take you to the nurse who will help you." I wish someone had done that earlier. If someone had spoken to her before she had that first encounter of sex, the whole story would have been very, very different. Her whole journey would have been very, very different. But now what you say to this girl who comes to you and says, "I'm HIV positive, my baby's HIV positive. What next? Is there hope for me?" And you're talking about dreams and aspirations. How can I achieve my dreams and aspirations when I'm positive? So that girl represents a lot of girls, not just in Zambia, in Africa, globally. There's girls who are like that, who we have missed in their journey. We've not been there to help them make decisions, the right decisions at those moments in their journey.
So that makes me think, in Zambia, how is sex ed viewed? Is there a comprehensive sex ed that's taught in schools or out of school programs, or is there not really sex education at all?
There is sex education, and the government of Zambia is doing very well. We've got comprehensive sexuality education where girls are learning about sex outside and in school. Okay. Well, not really sex, but sexuality. But the challenge with comprehensive sexuality education is the link from education to actual service delivery. And that's very, very important, because you can give all the information you can to this girl. If they're not able to access the service in the end, then that journey is not complete. So we really need to strengthen that gap. And also, we need to educate and make parents and communities aware to say comprehensive sexuality education is not just learning about sex. Because as a parent, if you're thinking, now you're teaching my child about sex, I don't want them to learn about sex. But comprehensive sexuality is more than just sex. There's a lot of it. There's empowering a young person to be able to make sexual health decisions. So we need those two done. Bridging that gap between education and services, and also making communities aware to appreciate what comprehensive sexuality education really is.
So we've talked a little bit about some of the barriers that young girls face. Do you maybe want to talk a little bit more about what barriers they have to deal with when they're trying to access care?
I think one of the greatest barriers also is that there is not many safe spaces where girls can actually go and get a service. You expect a girl to go to a facility where there's Grandma Inonge, who's 50 years old, and you're 15 years old, and you go and queue up with Grandma Inonge. That doesn't feel right, doesn't feel discreet. I'll give you an example, again, in one of my field works. So I was talking to one of the government nurses about discreetness and the private service. And she told me a very, very sad story. She said one time there was a girl who came. She came for a pregnancy test. And so when she came to see the nurse, she was still quite busy. So she said, "Oh, you take a seat. I'll be with you in 5 minutes." And so she sat by the bench where there was these other women. And for sure, within 5 minutes, she came and got her to attend to her. But what she did not do was to make that girl sit in the right spot. She asked her to sit on the bench where there were women who had come for antenatal care. So everyone who saw her there was like, she's pregnant. She's pregnant. Mm-hmm. That's why she's sitting on this bench. And before long, the whole village was talking about her being pregnant. She's pregnant. She was even at the antenatal care. We sat with her by the bench, And the parents now are asking her, are you pregnant? She was like, no, I'm not pregnant. Everybody was asking her, are you pregnant? Then they were like, no, pregnancy shows. We'll wait a few months and we'll see. And they waited and she was not pregnant. The next thing is that, oh, she's had an abortion. So you can see how then can a young person go and access a service in such a place when it's not safe. Even just sitting on a bench, people begin to accuse you of things that you are not doing. So we really need to be able to provide this discreet and safe spaces where actually girls can actually come in and get a service. And also provide a biasness. As providers, we should not be biased. We should not be telling young girls to say sex is not for you. Do you know what that means? If you tell me, I come to you and you tell me sex is not for me, I'll go and ask someone who cares.
Right.
And I'll go and ask this wrong boyfriend and say, I was told that sex is not for me. And the boyfriend would tell me, come, I'll tell you all about sex and I'll show you how it happens. And that's how you end up having unprotected sex, because you found refuge in this person where when you went to people who are supposed to really give you the right information, they said this information is not meant for you. So those are some of the bigger challenges that we face. Of course, there's some things that are being done about it where providers are being, trained with values clarification, where you're able to say, look, it's not about me, but it's about this young person who's come. But it's not everybody who is doing it.
So I know that is one of the things that MSI is doing. So what led MSI to look at some of the most effective ways to reach these young women?
Yeah, so I'll give an example of Zambia. So back home in Zambia, we had a clinic, a very nice, beautiful clinic, which was very spacious, and we had nurses and we had all the contraceptive methods there, and everything was all happening, and we thought we had it right. But young girls were not coming. We had adults coming, but young girls were not coming until we followed the journey of a young girl who came. We're like, okay, let's follow her journey and try to understand exactly why is it that young girls are not coming? What are we doing wrong? So she came through the gates, talked to the guard, came in through the reception and got a service. And afterwards we spoke to her. How was the service? Yeah, it was okay. Would you recommend it to your friend? No. Why not? Well, I got the service. I got what I wanted, but the experience wasn't nice. I came in, I waited for a long time in the reception, and every time I was there, I thought mommy was going to walk through. And then I was taken inside for counseling. We had very spacious rooms with a lot of rooms for counseling. And she thought every time I turned, a corner, I thought there would be someone I know, And I sat down with the provider. She was really nice, and she spoke to me about contraception, but she was very quick to judge me that I'm having sex. So if you're having sex, here's the best method for you to use, And she showed me all these methods which were very scary and told me, oh, this one is a long-term method. This is the best protection for you. I got the method, but the whole experience wasn't good. That's when we realized that we had a problem. We didn't know who an adolescent was. We didn't know how to make contraception appealing to them. And so we went into research mode to find out, how then do you want contraception presented to you? And we talked to dozens and dozens of girls, and they told us, all we want is a discreet service. When we come to a space, we want a space which is a social space where we can find fellow young people whom we can talk to about sex and relationships and have honest conversations. But when we come to your center, the first person you see is a provider who would tell me family planning, And I'm not planning a family, I just want to have sex and to have it safely. I don't want to space kids because I don't have any kids I'm spacing. So we realized that even our language was very wrong. We didn't have the right language which would be appealing to girls. And so we had to change. Business as usual was not working. We had to change. Then how can we make contraception appealing? And so we engaged young girls whom we call teen connectors, who when a young person comes into our youth center, that's their first contact, this young face. And they'll have those honest conversations, and then they'll go and get a service from the provider. And the youth space, the whole model which we gave birth to is called the Diva model. It came from the young persons themselves who said, we want a space which is bright and nice colors. And so when you come to our youth centers, they've got the greens and the reds and, and it's a whole nice social space where girls can actually sit and talk and have honest conversations more than just contraception. They'll talk about hygiene, condom negotiation, HIV, menstruation, how does the body work and so on. And then they go out there and get a service. But most of all was that we needed to link contraception to what was really important to the girl. And what was important to the girl? Her aspirations and dreams for her future. And so then it was, here is a contraceptive method so that you delay pregnancy, so that you can achieve your dream. At some point we were saying, here's family planning so you can space your children. Right. Okay? And girls were like, that's not my message, But now we're talking about aspirations and dreams and being empowered. And so girls can now relate to contraception. And we've seen girls now coming into the center because it is so demedicalized. When they come, they're saying, we are not sick. We just want someone to talk to, someone who will understand what our dreams and aspirations are.
That's so great. And I really like they talk about the importance of language, because it changes everything, as you noted, right? Going from framing it as not family planning for timing and spacing your kids to what's important in their lives. And that made a huge difference for them. Exactly.
Because you see, if you come to me who has kids and you talk to me about family planning and birth and spacing my kids, it will appeal to me because I'm thinking, okay, my son is 2 years old. I think maybe I won't be ready until 2 years from now. Mm-hmm. Then spacing becomes appealing to me. But if I'm 15 years old and you come to me and tell me about spacing, it doesn't make sense. If you tell me to say, no, you need to wait, WHO says you need to wait for 2 to 3 years for you to be healthy enough to have another kid, then the uterus will contract, it will contract
that's well enough,
And you're like, I'm 15 years old, I don't have a uterus that needs to contract, So that message is not appealing. And I'll say no to contraception. I'll say no to family planning because your language is just wrong. So we need to get the language right. How can contraception be appealing to young people? We need to get the language right.
So let's say I'm a girl and I go to this clinic now. What does my experience look like?
So your experience would be something that is really appealing to you, that was designed for you. And we call that a user-centric approach. And with user-centric approach, you have the people you're designing for in mind. You can't design anything without involving the people that it's meant for, because you will get it wrong. I'll give you a very typical example. So when we came up with the Diva model, which was very urban, for urban girls, it's very nice and fancy. Even the way we look at contraception, we have these cartoons which speak about contraception. And so we got the brand and took it to rural Zambia, okay? And we went to see our adolescents in rural Zambia and said, here is a brand for you to actually use contraception. And the girl said, no, this is not for us. Look at these cartoons. They've got nail polish. They've got lipsticks. They look like prostitutes. Look, they're wearing boots and they've got phones and so on. No. This is not for us. So you see, that brand worked for urban. It did not work for rural. So anything that's user-centric needs to have the user in mind. And so again, we have to go back to the drawing board. Who is a rural adolescent? Mm-hmm. What is appealing to them? What is their aspiration and what's their dreams? And it was very, very clear that there were two different groups. And that made us realize that young people are not homogeneous. The fact that I'm 15 years old does not mean that I'm like everybody else. I'll give you an example. If, for example, we are both 30 mm-hmm. and we're looking for a gym program for weight loss or for just looking healthy, mm-hmm. our needs will be different despite us being 30.
Right.
Yeah. Because I'm African, I'll probably be saying, hey, men like women with big bums. So I want exercise which will give me big bums, And maybe you being from the West, you'll be like, no, I want a big bust. Is there any exercise which can make my bust big? But we're both 30 and the needs are different.
Right.
So what makes you think that a 15-year-old is the same? I might be 15 and not in school. Right. I might be 15 and be in rural Zambia. I might be 15 and be in urban. I might be 15 and with a kid. So the needs are very, very different. And so when you're talking about user-centric, you have to look at the moment that the girl is at when you're designing for that intervention to be appealing to that young person. Or else you get it very, very, very wrong.
Absolutely. Yeah, it's so important because everyone has a different life experience and it's so important to focus on the girl and where she's at. So what have you seen the impact be?
So what we've seen with the impact from the different interventions that we are doing in Zambia, we've seen a very significant growth in the number of girls who are coming to our centers. So between 2013 and 2018, we've seen a compound annual growth of about 55% of girls coming in. But for me, that's not very important. What is really important is the fact that we are having girls walk in and saying, I just want to listen to you. I just want to know what hygiene is because this place is safe.
Mm-hmm.
Okay. They may come in and not walk away with a method, but they'll come in and get some very impactful information about their sexual health and be able to make very impactful decisions for their own lives, which they can't do at a facility where there's biasness or where providers are judgmental. So having user-centric approaches has made the youth centers or our approach very youth-friendly, very youth-focused. Any young person can come and say, look, I just want to listen. I just want to learn. Or I want to get a method.
No, it's so important to have a safe space to go where you can learn and know that they're getting honest information and accurate information. And, think about, the story you told at the very beginning about the girl who had the baby and was HIV positive, and the baby was HIV positive. If she had somewhere to go earlier, that could have changed so many things down the path for her.
Exactly.
Here in the U.S., we're seeing a lot of states passing bans on abortion. What does abortion access look like in Zambia, particularly for young women?
So abortion in Zambia is legal, but there are some restrictions.
Okay.
For example, you need 3 doctors to sign off an abortion service. And that can be a challenge, that can be a barrier, but it is provided for in the Constitution. So what we still need to do is to make young girls aware to say it is legal. You can actually access it and direct them to where they can actually get a service. In my experience, what I've seen, when you put all these barriers, it doesn't stop unsafe abortions. It actually increases the rates of unsafe abortion when you restrict abortion, safe abortion. Because when a girl has decided to terminate, they'll do it anyways. You're better off giving them a safe place where they can actually get it done. I'll give another example. I've got lots of examples.
I think examples are so important for people to relate to.
So we have a toll-free line, 5600 in Zambia, where girls can call for whatever information that they need. And so we had a young girl who called and said, I've tried to terminate from home because I thought I could not afford an abortion. So she came to our center, and we had to complete the abortion service. But when she came, it was really, really sad because she didn't have anyone to tell. She said, I can't tell my mommy. I can't tell daddy because as far as they know, I do not have a boyfriend. So how can I be pregnant? I don't have anyone to talk to except the toll-free line and yourself. So I thought of being part of the procedure, so I try and understand how the procedure is done. And this girl lay there on the couch in pain and during the procedure because it was very, very painful. But because of our cultural background where a woman is not supposed to be heard, so she was crying quietly, like no sound. There were just tears rolling down her cheeks in pain. And there was no one to tell her story except to Mary Stops, except to the toll-free line. And she went through the procedure, and all she was saying, I'll never have sex again. I'll never have sex again. Because now the perception of sex was now very bad. Like, it was very painful. It was very, very negative, And she was saying, I'll never do this again. But due to the good counseling, she actually also got a post-abortion family planning method, which was great. But I think the sad thing was, even after that procedure, there was no one to go back home to tell her story because she was too scared. So can you imagine if we had a ban to this service? If we banned to say, look, Mary Stops, you cannot provide this, where would such a girl go? She's not the only one. She's representing a lot of girls in Zambia, a lot of girls in Africa, a lot of girls globally who need that support. And sometimes they don't have anyone except the toll-free line, except that provider who's given her that service. So let us not deny this service to young girls. It is their right. We owe it to them. We owe it to them. If someone had talked to this girl earlier, maybe she wouldn't have gone through all this. But we missed the moments when she needed us. Even at this very last moment, why should we deny her the service? It is her right.
I really like your talk about important moments to be there, right? Not missing these moments and making sure that you are there when you are able to. It's just so important as we're watching attacks on reproductive health care in the U.S. and we've seen some of those attacks be exported in U.S. policy abroad, that you're going to have more people who are missing those moments and aren't going to be there, and that these girls are the girls who are going to suffer.
I would like to talk to policymakers that these policies that we make, they're not for us. They're for this generation that is coming. It's a very, very huge cohort. It's the biggest cost in history. And if we miss it, we are significantly going to affect the population. So even as we make these policies, let's not think of now, and how many votes I'll get. It's not about us. It's about these young people. Let us invest in them, because the dividend in the cohort is worth the investment. Let's not be selfish and say, no, this policy and that policy and so on. Let's think of who really is in need.
So what are your hopes and dreams for the girls in Zambia?
My hopes and dreams for girls in Zambia is very simple. I would like to see a girl who's empowered, a girl who's able to make significant decisions about her body and her future.
So I always like to end with a hopeful thing, like what can listeners do? Do you have anything? Like what would you like to see people who are listening to this podcast, what can they do to make things better?
What you can do as an individual is to listen to this young girl. Do not judge her. The fact that she's come to you to seek help is a big step. So if someone comes to you and says, I need help, there's options out there. If you cannot provide that support, show her where she can get help. It's as simple as that. We are not saying that you need to change your values. Sometimes it's hard to change values. And if you can't change your values, at least point them to where they can actually get help, so that you don't miss that moment in that girl's journey. Can you imagine this young girl who comes to you and says, how can I have safe sex? And just saying, go away. And she goes and does a wrong thing. And she ends up with a disease and pregnancy. I think that's worse than telling her or pointing her to the right direction.
Okay, thank you so much for being here. I hope you enjoy the rest of your time in DC.
Thank you. I know I will. I'll do a lot of sightseeing this week.
Good.
Thank you so much for having me.
Welcome to rePROs Fight Back, a podcast on all things repro. I'm your host, Jenny Wetter, and each episode I will be taking you to the front lines of the escalating fight over our sexual and reproductive health and rights at home and abroad. Each episode I will be speaking with leaders who are fighting to protect our reproductive health and rights, to ensure that no one's reproductive health depends on where they live. It's time for rePROs to fight back.